This is Dr. Jason Browder, simplifying manual medicine by putting principles into practice. Today we're going to talk about the sacral axes and how we use them in treatment. Now, this is not conventionally taught in osteopathic medical school. However, Ed Stiles discovered that if he treated sacral somatic dysfunction on the sacral axes, he got better treatment results. So this is empiric clinical evidence. There's no clinical studies to support this. However, I find the exact same thing in my own clinical practice. So for the sacrum, what I've designated here is the middle transverse axis. And what we're going to do when we treat the patient for sacral somatic dysfunction is we're going to put them or localize our motion and forces to the middle transverse axis. This works very well for sacral extensions. Likewise, when we have the right oblique axis in treatment, and I will demonstrate this with the patient, for treating a left on right sacral torsion, I will show you how we localize to the oblique axis to better our treatment chances. So as you can see, we have our subject, Dr. Diane Medella here, sideline. And what I'm going to demonstrate is how we localize to the middle transverse axis and then the right oblique axis for a left on right torsion. And so to localize to the middle transverse axis, I find her PSIS, which is about the level of the second sacral segment. I take her arm and I introduce rotation down to that level. Put her hand under her head and lock that position in. I'll then take my other hand and lock in. Now hold real tight here. Straighten her bottom leg out. And what I'll do is I'll flex and extend her hip until I feel that motion right along that axis. For a sacral extension, what I would do here is I would introduce a little bit of adduction, and then I would have her push up towards the ceiling and resist her for 3 to 5 seconds for muscle energy. For high velocity, low amplitude type treatment, I would then take my, localize her hip to this position here and add a little impulse downward. So likewise, for a posterior sacral torsion, such as a left on right torsion, what I'm going to demonstrate here is how we localize to the middle transverse axis, and then I convert it to the oblique axis. Again, there's no scientific evidence that this is of any benefit. However, clinically, this very much helps during the treatment. So again, I would localize her down to the middle transverse axis, which is about the second sacral segment. I would hold the patient here and keep a rotation in to keep her localized that segment. Keep her bottom leg straight. I'll flex her up to this position here and drop her leg down off the table. And then what I'll do is I'll either move her leg cephalad or caudad, and right there I can feel that middle transverse axis kind of convert to the oblique axis. And at that position, I'd have her again push her knee up towards the ceiling. 1, 2, 3, 4, 5, and relax. And repeat that several times for a muscle energy technique. Or I would take her leg and lock it in place like this for high velocity, low amplitude, and then add an impulse down. So this is Dr. Jason Browder discussing sacral somatic dysfunction. As I demonstrated, we use the middle transverse axis and localize it to either the right or left oblique axis during our treatments. This can be used during direct procedures or indirect procedures. During an indirect procedure, we might have the patient sitting and we have them lean to the right or lean to the left, and that'll localize to that axis. Likewise, you can have the patient cross their legs during a functional procedure. Thank you for watching this video. This is Dr. Jason Browder, simplifying manual medicine by putting principles into practice.